Hi, it's Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. I'm a physician in practice. It's March 19th, 2020. I'm going to do my daily COVID-19 update today. I'll be doing them every day now because the crisis seems to be increasing very clearly. So the data today shows we're at about 240,000 cases plus internationally and in the United States. We're going to hit 10,000 deaths tonight. Italy passed 40,000 cases, and this all started there 3 weeks ago, and they now have more deaths there at 40,000 than China had, with 80,000 reported cases. But as I've stated before, I don't think any of the China numbers are real. So we're starting to get a better idea of what happens when a relatively well-off country with pretty decent medical care gets this virus, and you get a large number of people with it. The death rate's about 3 to 4%, unfortunately. We may do better here, we may do worse. Right now we're at about 13.5 or 13.6 in terms of cases with 200 deaths. So our death rate stayed about 1.7%, but again, we'll just have to see what happens. And keep in mind there's a lot of wiggle in those numbers because there's tons of people who have the virus and we don't know they have it. There's tons of people who are asymptomatic with the virus. There's tons of people who probably had the virus, may have been sick and even died of the virus that we'll never know because they didn't get tested. If we look at Oklahoma City right now, Oklahoma City has 18 cases. The state of Oklahoma has 44 cases. We unfortunately have the most cases confirmed in the state of Oklahoma. We've had a death in Tulsa, and a 50-year-old. I do not know the history of this person, so my condolences to the family. We don't know if there was comorbidities, but again, definitely someone under that theoretical senior age range. There continues to be more information coming out from the federal government that younger people are getting it more often than it was originally thought, but not children and certainly not very many young adults, people 20 to 30. Let's talk about why again. The theory currently is there's an inflammatory mediator that falls into a family called interleukins, which are inflammatory protein mediators. And as that, there's one in particular that elevates, and when it elevates, it takes someone who has pneumonitis or inflammation on kind of the outside of the lungs to an extent and makes it very fulminant or very aggressive within the lung. And so it turns out melatonin may block that. That's what the preliminary data sets are showing. And why does that help little kids, or why are little kids safe? Because they have tons of human growth hormone, and if you have tons of human growth hormone, you have lots of melatonin. And so again, that's why people through their early 20s are in a pretty good bet. And again, it's been one of the theories that perhaps that's why pregnant women have done better too. Again, there is some recent concern about pregnant women getting it, but again, that's still early data, and I don't have an update on that yet, but I'm looking. So melatonin, let's talk about that. It's just kind of a hormonal thing you can take. People have heard about it for sleep. It's completely safe and boring stuff. It looks like just a little dose, 1 milligram a day, can interrupt the cascade, but you want to obviously been taking it for a while. If you take more melatonin, it can make you a little sleepy, but dosing up to 10 milligrams is routine, and even 20 milligrams is fairly routine for specific indications. So a little bit of melatonin definitely can interrupt the cascade of inflammation if you do get COVID-19. The other things I just want to emphasize tonight is what Dr. David Chanson said today at Integris in a recording. He's the head of infectious disease for the Integris Health System. He's a brilliant infectious disease doctor who happens to be a friend. He's taking this very seriously, as you can imagine, so seriously, in fact, he shaved his beard off so his N95 mask will fit better, which is scaring me about my beard a little. But David said one thing repetitively: we need to shut everything down or this is going to be a monster. He feels very strongly we need to shelter in place now. We need to stay at home. We need to not go out. We need to lead the charge to limit the spread of the disease because it's so aggressive and it's pretty much everywhere. We're just not seeing the cases because we're not doing the testing because there aren't any tests predominantly. Again, in Oklahoma City, there seems to be waves up and down of, oh, there's some tests and there's not. Currently, Integris ERs do have testing, and I'm sure probably Saints does, and most likely Mercy and OU, but there's a pretty strict criteria set right now that each hospital's using to decide whether or not someone gets a test. So that's gonna, if you go to get tested, you're gonna need to be ill, and for them to even consider giving you the test since there's such a shortage, which God willing will get better in the next week or two, but we just don't know. So I'm on quarantine day 2, which was really exciting today. I cleaned a drain and fixed some stuff around the house. It was, did a lot of phone calls and texting and chart reviewing. Not very exciting stuff, but I had a nice day. I feel fine. Can't tell anything yet if I have COVID-19 or not. Don't have my culture back. Hope to have the culture back tomorrow, but it may be Thursday. Again, I'm not particularly worried since, again, I'm taking my zinc 50 milligrams a day. I'm taking my melatonin. I've been on Plaquenil prophylactically, 200 milligrams twice a day. So I'm optimistic that I'll do fine, and if I do get it, but I'm also hopeful that I won't get it at all, so that would be nice too. Other things for us to think about is really getting ready for potentially the quarantine. I mean, people have asked me, why are you predicting that or saying that? It's because it's the only viable solution to bring COVID under somewhat control. If we don't do a quarantine pretty quickly, we can figure we're gonna have 200 to 300 million cases of it in the United States. And the problem with that is they're gonna be cases that come on quickly, and we'll have a crescendo of cases. And what we wanna do is not have that. If we have, let's say, 20 million people get COVID, 2 million people are gonna end up in the intensive care unit. If that's spread out over 10 months, that means it's 200,000 people in intensive care units a month. We can probably handle that. That will stretch and hurt the system because we don't have 200,000 intensive care beds, but we could probably handle something like that. If we have 20 million cases in 5 months, then we have a huge problem because we're going to have 2 million people need the intensive care unit in 5 months. That's 400,000 people needing intensive care per month. We can't do that. And so what happens to people who can't be in intensive care, who need it, is they die. And so that's why slowing the onset of the pandemic a little bit would be massively helpful. And that's why the shelter in place, stop these large gatherings, stop being in denial, all would be incredibly helpful for the country. One thing that I've noticed is, again, some people get it, some people don't. I see that in my daily life and people I interact with. But again, just try to ignore those people and do what you can. I would like to say thanks to all the people who've texted me or emailed me well wishes since I've been exposed, my partners, all my friends, and then a lot of doctors that I work with. I do want to give a lot of credit to Integris Health in Oklahoma City. All the healthcare systems are doing awesome. But Integris and their CEO, Tim Pearson, and their leadership group, who I'm not going to name all of them, but have really taken a stand of excellence to be ready for the COVID infection in our community. I can't praise them enough. But I also want to say Mercy, OU, Saints, all of them are doing fantastic. I just happen to know the people at Integris a little bit better. But all our main hospitals here are gearing up to support our community and do everything they can to help us. I can't give those doctors enough credit, in particular the infectious disease doctors. David Chanson, who I mentioned, is just working 24/7 right now on behalf of everyone, and the leadership teams at these hospitals are really doing fantastic and taking it very seriously. So we're blessed to be in Oklahoma City. So that's the update for today. Not a lot of new news. I just think we'll see what happens on a day-to-day basis. We'll see what President Trump has to say tomorrow. I think that may be a key day to find out if we're going to be having a quarantine on Monday or Tuesday. Anyway, take care and good night.